Hello, I'm Rollins, and welcome to Asian Hospital and Healthcare Management. This is your gateway to the latest innovations in hospital innovations, healthcare technology, medical breakthroughs, and patient care strategies across Asia. Whether you're in hospital administration, clinical operations, healthcare IT, or any corner of the healthcare ecosystem, stay informed and ahead of the curve with Asian Hospital and Healthcare Management, anytime, anywhere. Want more? Subscribe now at www.asianum.com/subscribe and get the latest insights delivered straight to you.
Welcome, listeners. I'm Lisa, and I'm absolutely thrilled you're tuning in today because we have a truly special guest with us. Today, we're joined by Dr. Dimitrios Kalogeropoulos, Chief Executive Officer of the Global Health and Digital Innovation Foundation. Dr. Dimitrios is a distinguished voice in global healthcare, driving change through digital innovation, artificial intelligence, and strategies that strengthen healthcare systems worldwide. His work touches on some of the most urgent challenges we face, ensuring equitable access to care, embracing digital inclusion, and building climate-resilient health systems. The theme of our conversation is future-proofing healthcare, integrating AI, digital inclusion, and climate resilience. So let's not wait another second. Dr. Dimitrios, welcome to the Asian Hospital and Healthcare Management podcast. It's fantastic to have you here. Let's dive into this important conversation.
Greetings to all the listeners, and my sincere thanks to Lisa and the Asian Hospital and Healthcare Management team for this opportunity. Hi Lisa, it's truly a pleasure to join this platform that connects healthcare leaders across the globe. The theme of today's discussion, future-proofing healthcare, resonates deeply with my work, and I'm excited to explore how technology, innovation, and resilience can shape a healthier future for all of us. I look forward to exploring it with you in this discussion.
Thank you so much, Dimitrios, for that wonderful introduction. Let's dive right into our discussion. To start off, how can AI-driven personalized medicine redefine healthcare resilience? And what specific innovations do you see shaping the next decade?
Nice question. Thanks for asking, Lisa. Healthcare systems globally are under increasing strain, particularly in areas such as mental health, where demand is outpacing capacity. Many of the underlying health issues are preventable. AI-driven personalized medicine offers a compelling path to greater resilience by enabling smarter, more efficient use of limited resources. A particularly promising frontier is the convergence of precision medicine and integrated public health, where AI analyses large-scale, complex datasets to deliver more tailored, timely, and preventative care. The goal is to stay one step ahead of disease. Looking ahead, the vision is to create learning health systems, where population-level outcomes feed into real-time clinical decision-making. This enables deeper insights into disease trajectories and supports adaptive, personalized interventions for individuals and communities. Such systems evolve continuously, becoming more participatory and responsive to changing needs and contexts.
Nice perspective, Dimitrios. So AI is helping healthcare work smarter and more preventively, and learning health systems make care more adaptive and resilient. Let's move on to the next question. What are the key systemic barriers preventing AI from achieving widespread adoption in digital health, particularly in preventive care, and how can we overcome them?
That's a great question, Lisa. Despite the promise of AI, adaptive applications in personalized care remain nascent compared to more deterministic tools. This is due to several systemic challenges, including infrastructure gaps, integration issues, and service models that have yet to adapt to a digital-first paradigm. Innovation is needed on two fronts: enabling digital-first care, such as proactive screening via chatbots, and integrating digital capabilities into traditional models, like hospital-at-home programs. With these service models, we are shifting from passive retrospective consent for secondary data use to active participation in precision learning systems embedded in care. To make this transition sustainable, we need to invest in digital infrastructure and equitable access, design AI tools for real clinical workflows, and establish robust methods for evaluating cost-effectiveness. Most critically, public trust must be earned through education, engagement, and co-production. Many of these innovations are already underway, accelerated by generative AI and rapid, adaptive prototyping.
Thanks for sharing, Dimitrios. That's a great perspective on AI and personalized care and the steps needed to make it sustainable. Let's move to the next question. How can AI improve mental health interventions, particularly for burnout prevention in healthcare professionals, while ensuring ethical and unbiased implementation?
That's an important point, Lisa. Burnout is a complex, multifactorial condition, especially among healthcare professionals, where it's becoming alarmingly prevalent. AI can play a pivotal role in prevention by analyzing systemic data, such as workload patterns, over time. But workload alone is not a strong predictor. Additional longitudinal, context-aware data is essential to detect weak signals and temporal patterns that enable timely, personalized intervention. Self-reported burnout scores collected through digital surveys can serve as phenotyping tools, or proxy endpoints, allowing the capture of behavioral, environmental, and emotional markers. AI can then identify endotypes of burnout, much like in physical health conditions, and link these to tailored interventions. Adaptive AI becomes especially valuable here, modeling how burnout develops across different roles, for example, junior doctors versus senior nurses, and fusing behavioral data, for example, sleep, resilience scores, with organizational insights. Importantly, these tools should be framed not merely as research instruments, but as workflow supports that help prevent burnout at the system level.
Thank you, Dimitrios. That's a really valuable perspective on how AI can help tackle burnout, not just by tracking workload, but by combining behavioral and organizational data to enable timely, tailored interventions. Let's move to the next one. I'd love to hear your thoughts on: what role does digital phenotyping play in early detection and intervention for mental health conditions, and how can AI enhance its predictive accuracy?
It's a great question, Lisa. Digital phenotyping captures behavioral, cognitive, and environmental data through everyday technologies like smartphones. It allows us to detect subtle, early signs of mental health decline, such as disrupted sleep, reduced social interaction, or changes in speech that often precede clinical diagnosis. AI dramatically enhances the predictive power of this approach. Through deep learning, it can analyze vast, real-time data sets to uncover patterns invisible to human clinicians, just as we now understand that diseases like diabetes can have distinct endotypes despite similar phenotypes. The same principle applies to mental health. One diagnostic label can represent multiple underlying pathways to effective treatment. The future lies in combining AI's pattern recognition capacity with ground truth anchoring and expert validation. This will enable more dynamic, accurate assessments and context-specific interventions, moving us from detection to truly preventative, personalized mental health care.
That's a really insightful perspective, Dimitrios. I like how you highlighted AI's role not just in detecting burnout, but in preventing it at a systemic level. Moving forward, I'd like to explore another area where AI is making an impact. With growing concerns over digital autonomy, How should AI strategies evolve beyond consent-based models toward a truly participatory approach?
That's a great point, Lisa. Digital autonomy is central to person-centered care. Yet while we need better, more representative data, traditional models of static, opt-in consent are no longer fit for purpose, especially as AI systems evolve in real time. Agentic AI, capable of autonomous decision-making, has been around for a while and is already enhancing workflows in other sectors. In healthcare, it could coordinate care plans, manage workloads, and drive personalized prevention. But its growing independence raises critical ethical questions about agency, trust, and the balance between human oversight and machine autonomy. To evolve responsibly, AI systems in healthcare must prioritize transparency and explainability, embed ethics and compliance into design, use inclusive rights-based approaches to governance, and be co-produced with users, not imposed upon them. We must also rethink participation itself. Moving beyond static consent means creating dynamic, evolving relationships with users where data usage, system behavior, and decision-making are jointly shaped. Like learning health systems, participatory AI must evolve with people, grounded in transparency, shared agency, and civic dialogue.
That's a powerful perspective, Dimitrios. I really appreciate how you tied agentic AI not only to efficiency, but also to ethics and shared responsibility. Building on that, let me ask you this. How can AI-driven insights be integrated into existing healthcare infrastructure without exacerbating disparities in access?
That's an essential point, Lisa. This question cannot be separated from the social determinants of health or from climate impact, which increasingly compounds existing inequalities. Marginalized populations often face barriers in access, digital literacy, and care quality, leading to poorer outcomes. AI systems risk deepening these disparities if they are trained on incomplete or biased datasets. For example, the datasets we design for studies often systematically ignore comorbidities. Without inclusive governance and participatory evidence generation, insights may not reflect the realities of vulnerable communities and may reinforce rather than reduce inequality. To counter this, we must develop inclusive data strategies that prioritize underrepresented groups, ensure AI tools are accessible, usable, and embedded in the local context, and foster open collaboration infrastructures to bridge care and public health. Environmental exposure is one powerful starting point. It shows how integrating climate and health data can drive innovation and equity. It also exemplifies how digital systems can be made context-sensitive and community-informed.
Great insights, Dimitrios, especially on equity and inclusion. Let's move to the next one. How do you envision AI facilitating a shift from reactive to proactive healthcare delivery, especially in addressing chronic diseases and mental health conditions?
That's an exciting area to discuss, Lisa. AI can play a central role in transforming care from reactive to proactive, especially for chronic and mental health conditions. But the foundation must be trust, usability, and alignment with the workforce. Today, clinicians are overwhelmed by growing volumes of underutilized data. This contributes to burnout and slows adoption. AI must help close this gap by making data more actionable, reducing unnecessary burden, and proactively identifying risks before they escalate. Technology-enabled care, such as remote monitoring plans, is critical. Through regular health assessments and by integrating multimodal data, from wearables, environmental sensors, EHRs, and digital phenotyping, AI can flag early signals of chronic disease progression, recommend timely interventions, and support shared decision-making with patients. But alignment is key. Unless clinicians and patients see these tools as helpful, not burdensome, the shift will not happen at scale.
Excellent points, Dimitrios. I like how you frame trust and usability as the foundation for AI in care. Now, let's shift to the next question. What governance frameworks and policy changes are needed to ensure AI-powered preventive care reaches vulnerable populations effectively?
That's a wonderful question, Lisa. Europe's regulatory infrastructure, particularly the EHDs and the AI Act, offers a unique opportunity, with valuable lessons for global adoption. But technical frameworks alone are not enough. They must be matched by social and institutional readiness. To realize this promise, we must establish strong, interoperable standards for data quality and exchange, and improve collective consent mechanisms and civic engagement, and promote adaptive governance that evolves with evidence and practice. One of the greatest challenges lies in connecting fragmented datasets to enable anticipatory care. This requires not only technical interoperability, but also legal and ethical alignment across institutions. Ultimately, inclusive and trusted data ecosystems, grounded in shared value and co-created governance, are essential if AI is to serve all populations fairly.
Thank you, Dimitrios. That's a very clear take on Europe's role in shaping responsible AI adoption. I like how you stressed both the technical and social dimensions. Let's continue with the next point. Given the evolving regulatory landscape, how should AI developers and healthcare organizations balance innovation with patient privacy and data security?
That's a good question, Lisa. We've built many privacy regulations, but we're at risk of creating a compliance maze that hinders innovation and opens unintended loopholes. More fundamentally, we have yet to confront the question of ownership. Without addressing who owns the data, or who benefits from its use, we may undermine public trust and reinforce inequities. We need a new approach, where innovation projects are also policy experiments and where compliance is embedded from the outset. This includes designing systems for transparency, safety, and auditability, testing collective consent mechanisms beyond rigid opt-in models, and rethinking intellectual property and societal value in digital health. AI is not just a technical transformation, it's a governance challenge. Sandboxes, living labs, and participatory frameworks can help us prototype new value systems in real-world settings, ensuring that innovation is both ethical and sustainable.
That's a sharp observation, Dimitrios. I like how you positioned AI not only as a technical shift, but as a governance challenge. Let's move ahead with the next question. How can AI empower patients to take a more active role in managing their own health while maintaining clinician oversight and trust in digital tools?
Nice question, Lisa. Patients and clinicians work together to navigate health concerns. This relationship is central to care and must remain at the heart of digital transformation. AI should support, not disrupt, this dynamic. To empower patients while preserving clinical oversight, models of interaction must be developed at two interdependent levels: knowledge layer. AI can translate complex health data into actionable, person-centered insights, underpinned by improved data quality, explainability, and contextual awareness. From agentic AI applications to digital proxies, this layer enables shared decision-making and personalized care. Integration layer. AI tools must embed seamlessly into clinical workflows and relational dynamics, not add friction or bypass clinical judgment. This demands transparent governance structures, secure and interoperable data sharing mechanisms, and adherence to technical standards that foster co-designed, scalable innovation ecosystems. Together, these layers enable a shift from passive to active participation, where patients and clinicians are supported, not overwhelmed by digital tools. The goal is to enhance trust, improve health outcomes, and ensure equity across all populations.
Beautifully explained, Dimitrios. I like how you brought the patient-clinician relationship back to the center of digital transformation. For our final question, I'd like to ask you one last thing before we wrap up this interview. What key metrics should be used to assess the success of AI-driven healthcare strategies? And how can organizations ensure continuous improvement in AI models over time?
That's a great closing question, Lisa. The lack of clearly defined, universally adopted metrics and regulatory frameworks continues to create uncertainty, particularly for generative AI and large language models. The EU AI Act, effective from August 1, 2024, begins to address these challenges by establishing a legal foundation for AI systems. This is complemented by the General Purpose AI Code of Practice, which outlines key principles for providers of GPAI models. As a participant in the GPAI Q2P plenary, I have proposed the following metric-driven priorities. Community participation. Building AI systems by communities, not merely for them, fosters trust and contextual relevance. Metrics include relevant technical standards and AI accuracy in adapting to new clinical data and environments. Translate clinical applications into public health action. Metrics include the rate of translation from clinical AI tools to population-level insights, and the maturity of digital public infrastructures, enabling clinical to public health data feedback. Utilize public health knowledge to drive preventive participation. Metrics include the uptake of systems medicine-based interventions linked to AI-generated insights and the use of public health data in behaviorally informed outreach and precision prevention campaigns. Foster transparent, ethical, and inclusive governance. Metrics include public trust indicators, such as sentiment analysis and civic panel feedback on how well governance frameworks align with public values and emerging risks. These principles reflect the global shift towards trustworthy AI, anchored in human oversight, technical robustness, transparency, inclusivity, societal well-being, and accountability. Embedding these values into measurable metrics enables organizations to continuously adapt their strategies, balancing innovation with safety, trust, and impact.
That was a truly inspiring note to wrap up on. Dr. Dimitrios Kalogeropoulos, future-proofing healthcare through AI, digital inclusion, and climate resilience, is a vision that's both timely and transformative. Thank you so much, Dimitrios, for sharing your time, expertise, and thoughtful insights with our listeners. It's been a privilege to learn from your perspective on how innovation can truly shape healthier and more resilient societies. Your emphasis on equity, trust, and collaboration, alongside the opportunities AI brings, offers a clear path forward. I'm certain our audience will leave this conversation with both inspiration and practical ideas to carry into their own work. Once again, thank you for joining us and contributing to this enlightening session of Asian HHM Platform. To our audience, stay curious, stay informed, and as always, thank you for tuning in.